Get ready for an explosion of information, and if you love a good poop joke, you're in for a real treat. All things number 2 are probably the number 1 complaint among patients. Pay attention, because knowing these drugs will help you a poop ton on the boards, wards, and beyond. Yep, it's time to relax while we introduce you to the amenities at the Laxatives Spa. Disimpact while soaking in one of our numerous hot tub options. Disimpact emotionally, of course. Let's start off by talking about constipation. Constipation is marked by straining hard poops, or cleaning house less than 3 times a week. Hence we've got more X's than checks marked on the bathroom cleaning schedule here. It's a common problem in elderly and debilitated patients, as well as in those taking certain medications like chronic opioids or anticholinergics. Before reaching for laxatives, start off with lifestyle and dietary changes. Good bowel movements start with a high-fiber diet, adequate hydration, regular exercise, and going when the urge arises. And nature should take care of the rest. If lifestyle changes aren't enough, however, then some kind of long-term laxative regimen may be considered. Okay, step right up. This is your window of poopertunity to learn the art and science of laxatives. Think of laxatives as step-up therapy, which we've clearly symbolized by this step stool. As you move up the steps, the laxative types get just a little harsher on your gut. Step 1, gentle bulk-forming agent. If these don't do the trick, step up to a stool softener. Osmotic laxatives are next, then stimulant laxatives. At the very highest step are suppositories or enemas. These can be pretty brutal, believe us, and should be reserved for when things get really backed up. And if your patient has chronic constipation, there are certain drugs available by prescription. Okay, let's start off with the bulky ones. The bulk-forming laxatives are indigestible hydrophilic colloids that absorb water, forming a gel that distends the colon and promotes peristalsis. Common preparations include natural plant products like this psyllium seaweed over here. There's also methylcellulose and synthetic fibers like polycarbophyll. To achieve a laxative effect with bulk-forming agents, be sure to drink plenty of water, or else you'll be left with poop pellets that are hard to pass. Also, these agents can take a few days to work, so might not be the best option for quick relief. Next, the stool surfactant agents. But you can think of these as stool softeners. Surfactant agents soften stool by facilitating the penetration of stool by water and lipids. You may even say that they rescue your system from those hard-to-pass poops. So we've represented them with this rescuer and his surfboard. He'll save this sinking boat from certain doom, Baywatch style. Now don't you fear. Common agents include docusate, hence the doc. Docusate can be quite the lifesaver for your hospitalized patients. It's commonly prescribed to prevent constipation and minimize straining, and is often combined with senna, a stimulant laxative, which we'll cover shortly. Remember, stool softeners are gentle on the gut and make it easier to go, but when it comes to treating chronic constipation, they are less effective than other types of laxatives. So let's step up to osmotic laxatives. We're going to take a nice bubbly soak while we get into the osmotic agents. They're non-absorbable or poorly absorbable substances that sit inside your GI tract and attract water into the lumen, thus distending the intestinal wall and increasing peristalsis. These osmotic agents include magnesium-based drugs, mag hydroxide and mag citrate, hence the magazine here. And those who subscribe to this Business Insider can actually take care of their business quite rapidly. This is because these agents cause the rapid movement of water into the distal small bowel and colon, leading to a high volume of liquid stool followed by bowel evacuation. Relieving to say the least. These magnesium agents are great for relieving acute constipation. Yep, set the timer and off you go. You can also use them to help alleviate chronic constipation, though their efficacy is unclear. And you may recognize magnesium hydroxide by its other name, milk of magnesia, a commonly used laxative. Watch out, though. Prolonged use in patients with renal insufficiency can lead to hypermagnesemia. And this mineral spa filter here should remind you to watch out for drug interactions. Magnesium, like other metal ions, can stick to chelating drugs, like tetracycline antibiotics, which prevents their intestinal absorption. Separate the doses by a couple of hours. Our next osmotic agent, polyethylene glycol, or PEG, is a large, non-absorbable osmotically active sugar that draws water into the lumen, much like removal of this wooden peg here pulls water into that drain. PEG is also a great drain cleaner. Lavage solutions containing polyethylene glycol are commonly used for complete colonic cleansing before GI endoscopic procedures. PEG is usually balanced with sodium, chloride, bicarbonate, and potassium so that no significant electrolyte shift occurs. You're going to love this next osmotic agent. Just sit back and relax as we sprinkle a little relaxulose, our sketchy symbol for lactulose. Lactulose, along with sorbitol, is a non-absorbable sugar that can be used to prevent or treat chronic constipation. Watch out, though. These sugars are metabolized by colonic bacteria, producing severe flatus and cramps. Okay, who's down for a little bubbly? Oh, wait. Did we turn the jets on? Okay, those bubbles might be a product of some natural gas there. Yeah, let's move on. The fact that colonic bacteria like to munch on that lactulose, however, can actually be put to clinical use. This gives us the perfect opportunity to discuss how lactulose is used in the treatment of cirrhosis-related hepatic encephalopathy. Hepatic encephalopathy is a neurologic complication of cirrhosis. See that brain and liver-shaped coral here? And for more on pathophysiology, check out our path sketch. One thing to know here is that this condition is all about ammonia overload, and lactulose helps to flush that out. Hence, this worker is fishing out that floating bottle of ammonia. It's actually your intestinal bacteria that are the ammonia-producing culprits, because they degrade nitrogen products. What can we do about all this ammonia getting absorbed from the GI tract? Well, let's see what happens when we administer lactulose. These hungry little fish should evoke an image of intestinal bacteria gobbling up the lactulose you've just administered to your patient. These bacteria degrade this non-absorbable sugar into acidic metabolites, hence this tank's meter is glowing around a pH of 3. Well, the acid converts toxic ammonia into ammonium. In other words, NH3 turns to NH4 positive, hence the plus sign on our net. Ammonium gets trapped in the lumen and excreted. Besides promoting the excretion of bacterial-derived ammonia, we can also get rid of these bacteria altogether. That's where our rifaximin fisherman comes in. Hey, that's no man. That's a kid. Oh well, that's what happens when you drop your kids off at the pool, or, tank. Anyway, rifaximin is a poorly absorbed antibiotic that pretty much sits in your GI lumen and kills off the bacteria responsible for all that ammonia production. Well, we think this side effect is pretty obvious here, but fair warning, that's not mud. And by the looks of this frantic lady, bet you can tell that excessive diarrhea can lead to spilling water, or dehydration. Careful there. Remember that it's very important that patients remain adequately hydrated to compensate for fecal fluid loss. Okay, now for a little stimulating discussion. Yep, let's talk about stimulant laxatives, or cathartics. We can think of these agents as a belly massage of the internal variety. Hence, this customer is getting a deep tissue belly rub. Stimulant laxatives actually get the GI system moving by causing direct stimulation of the enteric nervous system, in combination with colonic electrolyte and fluid secretion. Senna is one of these stimulant laxatives, depicted by the suntan lotion. Senna is poorly absorbed, and after hydrolysis in the colon, it produces a bowel movement in 6 to 12 hours. Another stimulant laxative is bisacodyl, depicted by this bicycle cruising down the beach. Bisacodyl can be taken orally as a tablet, or delivered rectally either as a suppository or enema. These drugs are pretty safe, but continuous use of stimulant laxatives can lead to loss of salt, potassium, and proteins, hence the trashed peanuts, banana peel, and chicken wing. And we've depicted the characteristic brown pigmentation of the colon known as melanosis coli with this customer's senna suntan. When all other laxatives haven't worked or when dealing with a severe out-of-order situation, it may be time to bring in the big guns. Sketchy Toys' latest, Fart Darts, and Super Pooper 5000 series, patent pending. So try a bisacodyl or glycerin suppository. If that doesn't work, you may need to evacuate the bowel with a super effective enema. Warm water is gentler and carries less risk than sodium phosphate, aka fleets, and is especially preferred in elderly patients. Lubiprostone, as depicted by the lubricating massage oil, is a locally acting chloride channel activator used for chronic idiopathic constipation, opioid-induced constipation in adults, and IBS-C in adult women. This bottle of spilled chlorine should remind you that this drug works by enhancing a chloride-rich intestinal fluid secretion, which increases intestinal motility. Linaclotide, represented here by this line of clothes, is another agent indicated for chronic idiopathic constipation and IBS-C. It works by increasing intracellular cyclic GMP, hence the grumpy suds, which stimulates chloride and bicarbonate secretion into the intestinal lumen. This, in turn, increases luminal fluid and accelerates intestinal transit. Finally, opioid receptor antagonists may also be useful when treating opioid-induced constipation, represented by this wrecked Me-utopia poster. Naloxegol and methylnaltrexol are some examples. And that's all for laxatives. Now hop on. Let's take this bisacodyl for a cruise. Aw, someone didn't loop the chain.